What's up, Michigan? I'm Lorne Plant. Welcome to another edition of the State Champs Michigan Extra Point podcast presented by Lawrence Technological University. Hey, LTU offers over 24 varsity NAIA collegiate sports, including football. Athletic and academic scholarships are available. Recruit yourself at LTUathletics.com. Extra Points also brought to you by the Michigan High School Athletic Association, Hungry Howie's Pizza, and the sports medicine professionals with the Detroit Medical Center. And today we are being joined by Dr. John Morasso. He is a high school football fan, as I have personally seen him on the sidelines. How are you today, sir?
Great, Lauren. How are you today?
All right, exciting time of year. Of course, in fall sports, as a lot of them are either in their postseasons or getting ready, like football. We're going to be talking dealing with injuries as it relates to football, and this is the companion podcast to our State Champs Michigan Extra Point talk show. It's the final week of the regular season, and on the show, we've got recaps of some of the best games in our coverage of Week 8. We have a preview of Week 9. Watch it on your preferred platform, Facebook, Twitter, Instagram, or our website, statechampsnetwork.com, or on our free streaming app. Now, we talk with the digital managing editor at statechampsnetwork.com, Matt Mowry, to talk about the latest state rankings in just a bit. But first, we're talking injuries and how you can deal with them, especially at this point in the season. All right, Dr. Morasso, let's get into it. What are some of the common football injuries that you see in your practice?
So football is a full body contact sport. So therefore, I really see injuries of all the different body structures, your feet, ankles, all the way up down into the hands, back, and neck. So in general, we see a lot of soft tissue injuries. These could include a sprain or a strain. Now, a sprain is when a ligament is injured, and ligaments connect bones to other bones, and they help with stability, where a strain is where a muscle or a tendon is injured. And this will happen with an overstretch injury, and it can range from that all the way to a complete tear. We see contusions and bruises, cramping, bone injuries, stress fractures. So really, we see it all with football.
That's right. It runs the gamut of injuries because football is a contact sport. Now, one of the things we talked about this actually on our volleyball podcast today with Dr. Brandon Kakos, and it applies here for sure too. There's nothing more scary, really, even as a someone on the sidelines when you hear that pop and there is an ACL injury in an athlete, and I'm sure at the moment they think the worst. But maybe you can clear the air. Is it always a season-ending injury, and can it be a career-ending injury?
Yeah, so ACL injuries in general are not always season-ending injuries. So if the ligament is completely torn or it's a full thickness tear, then those are much more concerning. But sometimes it's not a full thickness tear. Maybe it's a grade 1 sprain where the ligament was stretched. And if that's the case, based on the physical exam, based on if there's any laxity of that knee joint, and if there's swelling or fluid, would determine the next steps in getting a definitive answer. Usually that's going to include an MRI. And based on that information, we can get that in a timely manner. Sometimes if it's not a complete tear, then absolutely we can return even in the same season a couple weeks later. Now, if it's a complete tear, a lot of times those will end up requiring surgery if you're going to still do any cutting type activities, playing at a higher level. But absolutely, we see patients come back and they get really good rehabilitation after that surgery is done for the complete full thickness ones. And we see athletes at every level, from professionals all the way down to youth sports, that will end up recovering fully from their ACL. So just really important to get appropriate rehab after the fact to prevent further damage to the knee or even injuring other parts of the body if the knee isn't stable.
Absolutely. We're talking with Dr. John Morasso of the Detroit Medical Center in the sports medicine physician team. And, surgery is always, a scary word, especially when it comes to, athletes and their parents. But there have been so many improvements, so many enhancements in sports medicine. It's not always the first choice for injuries. And maybe you can just kind of ease the pain on some that there are a lot of ways that you can treat football injuries non-operatively.
Absolutely. Over 90% of orthopedic injuries, sports medicine issues are treated non operatively. There's really rarely a situation where we're going to recommend surgery right off the bat. So that is absolutely the biggest concern from patients and from their families. When they have an injury, of course we kind of think the worst, but if we get the right diagnosis, get you in the right treatment plan, there's a lot of different things we can do with home exercise programs, formal physical therapy, sometimes injections with steroids, sometimes without steroid, and just some like dry needling, acupuncture, cupping. I do a lot of osteopathic manipulation, which is a hands-on approach to correcting structural alignment. And when we can get everything in the right alignment, a lot of times you'll function a lot better. You can heal quicker, increase blood flow. So absolutely, we want to try to do everything we can non-operatively before we consider any type of surgical intervention.
Absolutely. Concussions are something that we deal with in football, maybe more than most sports. What should players, coaches, and parents know about concussions and return to play, most importantly?
So most importantly, we have to take concussions very seriously. If we ever suspect a concussion, we're going to remove the athlete at that time, and then we're going to be reevaluating. With a concussion, we will look out for a lot of warning signs that could be something more severe than just a concussion, like a brain bleed. So we always tell people to keep an eye out to make sure that they're not having a worsening headache, they're not having issues with their balance, really feeling lethargic or very fatigued or out of it, not answering questions correctly. Those are reasons that in that immediate setting, you have to get to the emergency department so you can get a scan of your brain to make sure you don't have a bleed. But 90% of the time, concussions will fully heal and fully resolve within 2 weeks. So we really take a stepwise approach as you work back from the concussion, and that includes increasing your activity and also increasing your learning as we can and as those symptoms are under good control. If we can do that and really get the athlete back moving, there's kind of a sweet spot where too much activity, if you're causing worsening of your symptoms, that'll make things worse. But also, even some of the more recent studies show if we just completely do absolutely nothing, that's not better either. So there is a sweet spot where you track your symptoms and you make sure whatever you're doing isn't making the symptoms worse, but you want to actually get a little bit moving as long as it's not causing a worsening of your headache and other symptoms. We want to get you moving to increase that blood flow and increase the blood flow to the brain to allow you to heal even quicker.
It's good advice. This is very open ended, but we're at the grind of the football season now. We're about to finish the regular season, get into the postseason. So that run for a lot of teams, it will be 4 weeks as they get an opportunity to compete for a state championships. And I'm sure there's a lot of things that athletes would like to be able to know what they can do to help reduce their chance of an injury.
Absolutely. So at this point of the season, it's very important to stay well hydrated, making sure we're getting the proper nutrition that we need. We're really putting a lot of demand on our bodies at this point in the season. So just like anything, right? Even a motor, if you need to put the right fuel and the right gas inside of it in order to get it to run efficiently, the same is true with our bodies, even more true with our bodies. Dynamic stretching is also very important. Just listening to your body and not pushing yourself beyond the point where you feel like you're injuring yourself. We're going to have bruises and bumps and bruises at this point in the season, but really just try to listen to your body. If you feel like something is more serious, it's better to get it evaluated, determine, is this something we can continue to play through, or is it something that we need to do some other treatments? And then also just making sure we're wearing the proper fitting pads and equipment. That's the biggest thing at this point in the season.
We're talking with DMC sports medicine physician, Dr. John Morasso. And thank you for your time today, sir. One more question for you. And this really is regarding when an injury can be treated at home, or, maybe even more importantly, the signs that you need to go see a sports medicine specialist.
The biggest things that I'm assessing on the sidelines and determining if this is something that someone can continue to play through are strength, range of motion. So if you have full strength and full range of motion, this is typically something that we can continue to play through. Anytime there's a lack of that, it's better to get it assessed to determine, is this something that we need to do something more, get some additional imaging, or is this something that we can continue to ice, kind of protect the area and allow you to keep playing. So strength, range of motion, bruising, or issues with balance, those are all reasons that that I think you should get checked out by a sports medicine physician.
Fantastic. All right. I want to thank Dr. John Morasso for his time today. Hey, if you have a sports injury keeping you sidelined, call the orthopedic and sports medicine team at the Detroit Medical Center. You can do that by calling 1-888-300-DOCS. That's 1-888-300-3627.